Hi, I'm Dr. Brian Koffman, a retired family doctor and a CLL patient myself, and the co-founder, executive vice president, and chief medical officer of the nonprofit CLL Society. And today, I'm going to be talking about some of the most important papers for CLL patients that were presented at the American Society of Clinical Oncology's annual meeting in Chicago in 2022. Now I'm going to be talking about the influence of racial and ethnic identity on overall survival in patients with chronic lymphocytic leukemia. And I'm going to start with the bottom line, and it's not good news. Black CLL patients die sooner than their white counterparts, even when controlling for other risk factors. The gap in overall survival has not improved in the 14 years between 2004 and 2018. Who did this research and where was it presented? Dr. Victoria Bardell and her colleagues at the Huntsman Cancer Institute in Salt Lake City, Utah, presented the results at the American Society of Clinical Oncology, ASCO's annual meeting. Let me give a little background. Chronic lymphocytic leukemia patients have highly variable outcomes, with many having a normal life expectancy and others passing quickly from their disease and its complications. What we say at the CLL Society is if you know one CLL patient, you know one CLL patient. Everybody has a different story to tell. We also know that CLL most commonly occurs in older white men. As a result, this group has been well studied in research, but studies of CLL among minorities are much less frequent. The researchers wanted to address this knowledge gap by inquiring as to the differences in treatment and outcomes based on race. So let's look at the methods and the participants. The researchers out of the Huntsman in Salt Lake City accessed the National Cancer Database, and we provide a link to this on the website, to identify CLL patients diagnosed between 2004 and 2018. Almost 100,000 CLL patients were identified, 97,804. As expected, 90.7% of the patients were white, 7.6% were black, that was a total of 7,391. 2.6% were Hispanic, 0.6% were Asian, and 1.1% were others. Compared to the whites, blacks were younger at the time of diagnosis, 66 versus 70 for the whites, and more likely to have other comorbidities. So a comorbidity would be another illness like heart disease, diabetes, that kind of thing. And they were also much more likely, more than 3 times as likely, to be uninsured, 6.6% compared to 2.1%. So what were the results? Black patients were more likely than white patients to have their CLL treated immediately after diagnosis, 35.9% of them versus 23.6% in the white population, foregoing the usually recommended practice of watch and wait in more than the usual practice of watch and wait in more than 1 out of every 3 patients. With a median follow-up of 4.3 years, the average overall survival for all CLL patients was 9 years. But for black patients, it was only 7 years compared to the white patients of 9.14 years. Adjusting for age and a standardized scale known as the Charlson-Diao scale. Now, this is used to balance other illnesses and comorbidities. Ranks are given, so we'll make sure we're comparing apples to apples. So using this scale and age, the black race was still independently associated with a shorter overall survival with a hazard ratio of 1.51, meaning that blacks were more than half more were more than 51% more likely to die sooner than a similar white patient with similar risk factors. While there was good news that the overall survival improved over time for all races, the relative survival of blacks compared to whites did not improve. Compared to the white populations, blacks diagnosed between 2004 and 2006 had a hazard ratio of 1.64, and those diagnosed between 2016 and 2018 had the identical hazard ratio of 1.64, meaning at both the beginning of the study and at its ends, blacks had a 64% higher chance of dying sooner than a white with CLL. So what can we conclude from this? Black race is associated with a shorter lifespan for CLL patients. While all those living with CLL are now living longer than in the past, blacks have not closed the gap in life expectancy. We need answers to address this persistent disparity. Let me give you some links and resources. If you want to get into more details, on the website, we have the actual abstract influence of racial and ethnic identity on overall survival in patients with chronic lymphocytic leukemia, and selected slides from their presentation. I want to also alert you to the fact that CLL Society is proud to be working with Mayo Clinic on a trial that might help us figure out why these disparities exist. Is it something about the genetics of the disease itself in blacks? Is the answer more environmental? Is it more about treatment choices or lack of access to therapy? We simply don't know. But if you're from an underrepresented minority, please consider helping us to get the answer by enrolling in this free trial. It is not an interventional trial, it is just studying what's happening in minorities. The title of the trial is The Genetics of Chronic Lymphocytic Leukemia, Small Lymphocytic Lymphoma, CLL/SLL, in African Americans and other minorities. You can find all the information about this trial on our website. I just wanted to share one other related trial that I've presented in the past, and that was from ASH, the American Society of Hematology's annual meeting in 2021, titled Uptake of Novel Agents as First-Line Treatment for Black and White Patients with Chronic Lymphocytic Leukemia in the Veterans Health Administration, a retrospective cohort study. And that trial did show a marked improvement in a closing of the therapy gap in the Veterans Administration over time. Will this eventually lead to better outcomes? Time will tell. Thanks for listening. Stay strong. We are all in this together.